So at the end of the day, you're done with your work, you attended to your patients, and you come back home. What is that one question that comes to your mind?
What we really need to be careful is about labeling people, before we make a accurate diagnosis of what the diversity is.
Because most of the teachers are probably not really trained, though they are supposed to, in picking up learning disorders well.
LD টেস্ট আমি করি নেবো, কিন্তু আমি কি অটিজমের টেস্টটা কেন করাতে যাব? কারণ অটিজমের টেস্ট যদি দেখতে হয় ইনক্লুশন, না ইনক্লুশন ঠিক আছে, কিন্তু স্যার অটিজমটা বাদ দিয়ে বাকি টেস্টগুলো করুন।
All we are getting are people who are pseudo specialists. Then I'll name the school also over here, South Point, please. And what happened is, when this child lost ambulation, they did not have a ramp. This child was bullied so much that she actually came back saying, I don't want to work.
Welcome to Truth Forecast, where the mind is without fear. Today we are discussing Beyond Labels, understanding the spectrum of autism and learning disabilities. Joining us today is Dr. Deepanjana Datta, Dr. Shumi Ghosh, and Asimi Nandi. Could you tell us a bit about your work?
So I am a genetic counselor, and I am also in capacity as a state coordinator for Organization of Rare Disease India, as well as the scientific advisor for Rare Warriors of Bengal. And I normally see patients who are or families who might have a genetic diagnosis, and then we do some hand-holding for them.
Dr. Ghosh, could you tell us a bit about yourself?
I'm a consultant pediatrician who's been working in Kolkata since 1997. I've had a stint in the UK from 2005 to 2008. Pediatrics has been my passion ever since my house staff shift days. And these 30-odd years of experience have led me to understanding, what's neurodiversity, which is a topic of discussion today, and trying to develop an approach which would make them an integral part of the children in the mainstream.
That is so lovely to hear. And joining us, as we said today, is Asimi Nandi. So could you tell us a bit about your work?
I am a pediatric neurodevelopmental therapist. I did my bachelor's and master's in physiotherapy with a pediatric experience, and then after that I just went to South Africa and completed my PhD also here. So my PhD is mostly based on was on movement disorder in neurodiverse, but still I'm learning. I am having experience of something around 20 years, but still learning.
So without much ado, I think we should begin with the topic at hand. So what would you say, what does neurodivergence mean to you?
Right. So, all of us as human beings, we are pretty unique. And supposing I were to open the window of a room, okay, what you perceive and what you see may be a lot different from what I perceive or what Oshiman perceives and sees. So the human mind is something which can interact with its environment, with what it's perceiving, what it is seeing, what it is thinking in different manners. So these differences in our perceptions with the mind that we have, that is what is defined as neurodiversity. It's a difference, it's not a disease. That is the message we would like to emphasize on.
What would you all say is the common misconceptions that surround something like autism? There is a widespread misconception regarding what autism is. How would you define that to a layman, let's say?
Autism, coming to that, misconceptions, there are many misconceptions. Autism is due to a bad parenting. So I would say it's a false. Autism is because of not giving the particular time to a child. Maybe the child has watched more of TV, so it's like, oh, it's on television, so oh no, so the main, you have missed that particular time. So I would say no, that is also false. But to be more distinct, and many misconceptions, whenever a childhood is not able to speak, that means he is autism. So it's like there are misconceptions are there. But to be more in that, how to bring it, autism is something like they are different, But the thing is, like sir said, like every brain is having a different structure, and its working pattern are different. So I would say, like, it's when they are different, but the thing is, like, they have a uniqueness in them. So every child, every child with neuro, maybe neurotypical, as well as when you compare with the neurodiverse, so they are having their own levels, and that we need to find it out, and we need to give them a little bit support.
So, what is the common misconception that you have come across more?
So, Mekla, I think so. What we really need to be careful is about labeling people, before we make a accurate diagnosis of what the diversity is. They're not all intellectually disabled. That is one misconception which has a very loud and clear message should go across. If I were to exemplify and take names of people whom we all revere and respect, you would realize that all of them were within this spectrum. It can be Charles Darwin, it can be Isaac Newton, it could be Einstein, it could be Tansen. They all had special capabilities. So this misconception that they are intellectually disabled has to be removed.
Absolutely.
The other misconception, I think so, which we've come across, is that people tend to think that they do not have feelings. They lack empathy. So it isn't like that. I would love to have a friend. This person also would want his circle of friends. I could feel hurt by any other human action. This little one, if not respected, if not integrated into a family or into society, would also feel hurt. And the other misconception as a pediatrician, which we faced down the last few decades, is that vaccinations apparently have been playing a role. This theory has been completely debunked with whatever evidence that we have, and this is something which we really need to clear out from people's minds.
What would you say is the salient difference between autism and other learning disabilities?
So basically, when you're talking about autism, you're talking about a social difference in communication. I wouldn't even say it's a miscommunication, all right? There are some repetitive patterns in that behavior, and there are some sensory issues also as to how they react to a particular emotion or to a particular environment. Whereas when you talk about learning disorders, it's more academic about what you read, your ability to write, or your ability to juggle with numbers, that is your mathematical abilities. So there can be an overlap between the two, but yes, they are distinct entities, and as Oshiman would probably elaborate, the treatment also is different, right? So we cannot be treating a learning disability and an autism under a stereotypical treatment.
So you also deal with a lot of patients who come in with learning disabilities. How do you treat them differently in terms of treatment? How do you deal with them? And what is the way you deal with autistic patients? How is that?
Like every therapy has been like a different, in the, like, suppose a learning disability in which, like, we need to find out like which area or like the child is lacking. Particularly it's in the reading part, or it's the mathematical part, or it's the writing part. So all the 3Ds of the learning disability is a common term is dyslexia. So the dyslexia, so we need to find out which 3 parts are missing. Like dyscalculia is it's termed with the calculation. It's the maths part, dyspraxia and dyscalculia. So dyspraxia is with the movements, with anything, like the child who is not able to copy the PT instructor. And then dyslexia is mostly having the problem in academics, and dyscalculia is mostly having problem in calculations. So this 3Ds has to be assessed, like which D is missing in a child. So once we assess the child, and then we start with the treatment, like what is, like suppose if a child is having a problem in writing, so that means when we write a S, so that means what we do is like we have this finger identification and finger localization, what we call it in our terms. So that means even like the finger which is moving like this, like we are patterning the same system in our brain also. So this is how, suppose the child is having problem with S, probably within writing, what is the typical problems are? Like writing with P and D, or it's P or Q, or it's the small letters B and D are always been like they have a spelling mistake. So what we do is, and a part of the therapeutic thing is like same, we do the brain mapping part of the thing. So what we do is we use sands or something like that, so that this thing gets a patterning in our brain, so that it's when it's represented in a 2 dimension on a paper, so that is easy for them. So every child, like suppose like when we treat with autism child, autism again what sir said was like diagnosis in three areas, which is the behavior part, which is the sensory part, and the communication part. So we check it like in the gold standard methods or whatever is that. So every 3 things we just check it out with that which part is less. So which part is missing out, the communication part, or the behavior part, or the sensory part. So whichever the thing is less, we start treatment with that particular area.
What do you think are the early signs that teachers and parents should look out for? Since it is, let's say, an uncharted domain, generations before this were very unaware of the existence of disabilities as such. What are the early signs parents and teachers should look out for?
The early sign, like visible sign to the teacher, is mostly the child is not sitting in the class, is the first sign, and he is not able to mix with the peers. The number 3 is not able to follow the instructions, and number 4 is it can be the name calling response. Whenever when the teacher calls him, he is either looking here or there. So whatever is that, whatever
Distracted.
Yeah, distracted. Number 5 is like not able to follow the instruction, not able to follow the blackboard. And this is a little bit like maybe the education, the academic part, like not able to follow, doing this, repeating the same spelling mistakes again and again. Calculations are a little bit difficult for him, and these are the common signs what I remember right now.
But I feel that there is pitches here. I think so, Ashman, you probably agree that this whole assessment, right? The earlier we pick up therapeutically, when I refer the child to you, you probably can do a better work, right? Than, people getting into a denial, hita hochche na, let's wait till so and so time. So in this, I think so very objectively, if you look at the immunization cards, or the booklets which have now been given to every citizen of this country, okay, even from the government sector, you have milestones which are well elaborated pictorially and in the vernacular, so that nobody misses out. So you are given milestones according to the age, and you're also given the red flag signs on the other side, right? So it really doesn't matter that you do not know how to read and write, okay? You can still follow that booklet, and if a social smile doesn't develop, if a visual fixation doesn't develop, if a name calling or response to simple 1-step or 2-step commands don't develop properly, our index of suspicion increases, and if we can refer them to the therapist ASAP rather than waiting for the child to be admitted to a preschool or to a mainstream school and then discovering the issue, that is where we probably need to focus on. That early diagnosis, early picking up of the signs. And in a small session like this, if I were to reel off a list of symptoms, the listener is going to panic, right? So let us be objective. So if you are going to a pediatrician who is giving you an immunization card, he or she, it is imperative, should be giving you certain milestones that you should be looking for at the appropriate ages. It could be 6 months, it could be 9 months, it could be 1.5 years, 2 years, 2.5, 3 years. And if as a parent you are concerned, you should address that concern to the pediatrician. And that is how we pick up things much earlier and we can put them on the right path.
So actually, being inspired by what you just said, how much of a deterrent would you feel denial is to treatment?
Well, Mekla, this is something, in medicine, when we are taught communication skills, life doesn't flow in a very smooth pattern for anyone, right? Okay. And we come to junctions in our journey of life where we have to break news to the patient, so-called patient, here could be a parent, which may not be very stereotypical, okay? Or pertaining to our discussion today may not be neurotypical, right? So this breaking of the news is an art which we all need to develop. We need to layer it out, and we must realize we are dealing with human beings. They aren't robots. They are going to be in denial. Think about yourself or myself. If somebody were to give me a diagnosis of cancer, I might be the most educated person in this world, but I have a heart. So I am going to be in denial. I am going to think, why me? So it will be a deterrent, but it is as much a deterrent as any other medical issue that we are dealing with. And we've got to find a way of getting them on board and telling them, I think so, this is what Oshiman also says, because a lot of my patients go to him, is that if you sit on it, you'll be there. But if you stimulate your child, you don't know where he's going to land up. He might be one of the most brilliant technicians. He might be one of the most brilliant minds moving around. So to explore that potential, the message is, yes, people will go into a denial, but once we educate them about the potential of this child through an accurate diagnosis, as he was, just elaborating, only then we can tell them what is the potential of this child.
Absolutely. So in what ways would you say the current education system is dealing with a situation like this? Do you think they are supportive, or there's more inclusion required?
I think there's more of inclusion is required, because they are doing their best, in the sense like they are supportive to these children as well as, but they need a little bit more support, like inclusion of more of IEP, like individualized education plan. And like another thing which is like special educators needs to be there in every school. And I would say like and few misconceptions about, like, if the child is not able to perform after 6 or something, after class 6, or they maybe easily go for a dropout. So to stop this dropout, rather than if they help with the assistive technology or something like that, I don't know whether this goes to CBSE or ICSE, whichever the boards is, if they're able to clear it out. So why don't they just make it a little bit ease, like the syllabus was for them? At least maybe they are not getting 90%. At least if they get 60%, still they will make something. They will do something in the later in the life.
So what would you say?
Yeah, I mean, your question is actually very, very pertinent. But before we answer that question, I think what we need to realize is we are not in utopia. We are in our country, which has its limitations, both resource-wise, education-wise, and the numbers, right?
Sheer number.
So what, the CAMS in the UK can do, the Child and Adolescent Mental Health Services in the UK can do, even if you bring those brilliantly trained people and put them amongst the Indian population, just the sheer numbers would, put a strain on them, all right? So the education policy is tailored for a particular country, and there has to be an amalgam of integrating them into the mainstream with early diagnosis, training of the teachers, ongoing, advocacy programs, giving them services under a roof, which Oshiman does so brilliantly, all right, okay? And also, we need to understand that while we are integrating them into a mainstream, we need to give them their special needs also. So if somebody needs half an hour more to complete an assignment, if somebody needs more explicit instructions to complete an assignment, that has to be given to that child. Today, even in a normal, neurotypical school, if say 3 of us are in a class and we are given a mathematical problem to solve, none of us are going to be doing it at exactly the same time. I might take a while longer. So I need the time to come to grips with it and form a solution. So the educational policy, there are, efforts which are now going on to, as he pointed out, to have individualized plans, but we still have a long way to go, miles to go, before we can say that we can integrate them into the mainstream. And where required, there has to be also special attention paid to the special needs of these children.
According to you, what would you say are the common misconceptions regarding autistic individuals?
So when it comes to autism, the first thing that I face as a question is that if I have the first child who is autistic, will I have the second child? And should I even plan? And would it be something like, I will face the same situation? So the answer is actually not a simple answer in these cases. As we look at it, that autism in about 40% of the cases may have a genetic background, which may or may not be inherited. So we have to separate genetics from inheritance. Everything genetic is not inherited. Sometimes we do have mutations or changes that can happen in the individual by itself, which is not sort of got from the parents or inherited from the parents. And in these cases, if the child has it, it's a new mutation. And in such cases, the chances that a second child will have this particular mutation is very less. In very, very rare cases, there are also situations where the family actually has different kinds of manifestations. Like you will see schizophrenia, you will see different kinds of neuropsychiatric mood disorders. And in these kind of the families, the answer becomes a bit difficult to answer, because in these cases, it is heritable. It might come up as an autism and a mood disorder behavior, but it may or may not have a single gene which is responsible. What we understand right now, there are small other genes, there are oligogenic effects, which can actually influence the outcome of whether this, at what spectrum of the mood behavior or neuropsychiatric issues or behavior issues this person is. So we have to evaluate, and there is so much we can evaluate. There's no straight answer for this, but in 40% of the cases, as documented by the American Association of Pediatrics, we do get a change. And in those cases, we might be able to guide the parents for that particular genetic issue. Understand, autism is a spectrum disorder and it is heterogeneous. So there's also gene-environment interaction. So we cannot say that you will never have a second child with autism. What we say is that your risks might be lower if there is no genetic etiology.
Right. So would you like to add something to the...
Another one which I commonly which I face is getting delayed. The diagnosis get delayed. So it's like the common misconception which I get is আগে কেন বলেননি, মানে এই জিনিসটা হচ্ছে না, ঘরের বড়রা বলেছে কি কথা বলছে না তো ঠিক আছে, পরে নিয়ে গেলে তোর বাবা তো কথা বলেছিল 5 বছর বয়সে. So that difference, that
the generalization of it.
Maybe the pediatrician also was maybe in his first year this visit was not able to tick the particular thing, like if the child is not speaking, when the speech is not proper, because already সে মানে ওইখানে ভ্যাকসিন, আচ্ছা ঠিক আছে ভ্যাকসিন ডাক্তারের কাছে গেছে, ভ্যাকসিনের কাছে আমি ভ্যাকসিন করে নিয়ে এলাম, কিন্তু যে কথা বলছে না ঠিক করে, সো এইটা তো ওইখানটায় আর কি মেন মানে ইয়েটা থাকে কি হ্যাঁ ওইখানেই মানে ডিলেটা হয়ে যায়।
How important is teacher training, fostering, and inclusion of understanding these?
Okay. Maybe I'm not really the correct person to say, but I'll say it from the perspective of what I've heard from my patients. তো অনেক সময় যেটা দেখা যায় যে বাচ্চাদের মধ্যে হয়তো মানে বিকজ উই সেড it's autism is a spectrum disorder. There are people who do not really have an intellectual disability but might have a learning disability. ठीक है तो so what happens is that ये बच्चाগুলো these children get picked up in school by the teachers because most of the teachers are probably not really trained, though they are supposed to, in picking up learning disorders well. I'm thinking that Sarba you would probably better answer this question. But what happens is that most of the time these parents would come up and will be called in the school for the child not doing well, not being able to submit. The child might show resistance in not being able to sit in the class, or the child not paying attention in the class. Sometimes it's also that we get a lot of these cases, they are being bullied in the class. And these children also at certain times they say that they probably can figure out that they are a bit different, and they go into those shells and they start feeling worthless, and that's a very heavy feeling. But that is how the school does not take that extra step to understand why the child is not doing well in class. So a simple thing like this is from my personal experience when I would say is the first thing is that ki apnar bachcha to mane onno bachchar moto porche na, onno bachchara 99.9% paচ্ছে, আপনার বাচ্চা তো 60% পাচ্ছে, মানে that's the first land. And if আপনার বাচ্চা 99.9% পাচ্ছে না, তাহলে this is not the place. You should do some assessment and tagging. ও তো বোধহয় মানে maybe the child has some other issues, but ও তো ADHD আছে. And this person does not even know what ADHD is, what is the
They jump the gun.
Yeah. Right?
So I think so. A while back we were talking about inclusion as a part of therapy. Now, who's going to include them? The parents are, once the diagnosis is made and you've gone through that denial phase, you've motivated them to get this child stimulated. Stimulated where? One is home, the other is school. Who's going to stimulate them at school? So unless and until you are training the teachers, and as Dipanjana said, it is mandatory now that if I am going to have an inclusive society, if I am going to be integrating them into the mainstream so that they don't feel left out, I must learn how to handle their special needs. They could have sensory issues. A child might just have a breakdown in a class full of children who are screaming, might just want his own space. So unless and until the teacher realizes that this child doesn't want to join the screaming and yelling that is going on, needs a quiet corner, quietly takes away the child into a quiet corner, or if the teacher doesn't realize that what she's trying to teach the rest of the class, this child needs a half an hour extra for this, okay? How are we going to integrate them into mainstream? So it is absolutely imperative that teachers' training, especially while we look to integrate them into the mainstream, is made compulsory. Because the teacher is the one who is going to be doing the work of the parent while the child is at school. And if the two are not in sync, a lot of good work that is being done by the parents, it gets destroyed in this country.
Especially because children spend a lot of their growing up years at school away from the parents.
And even when once the teacher says like just go and have a test for ADHD, and then they search, parents they search this in the Google এ দেখলো অটিজম স্যার LD টেস্ট আমি করি নেবো, কিন্তু আমি কি অটিজমের টেস্টটা কেন করাতে যাবো? কারণ অটিজমের টেস্ট মানে যদি দেখতে হয় ইনক্লুশন ঠিক আছে, কিন্তু স্যার অটিজমটা বাদ দিয়ে বাকি টেস্টগুলো করুন। So this is what the common and the coming up to the denial part. Autism তো এই গালি এসা हो गया মানে এটা মানে ইয়ে হয়ে গেছে কি এটা কেন বললো আমাকে এলডি বলুক লার্নিং ডিসেবিলিটি চলবে কিন্তু অটিজম যেন না বলে
The misconception runs so deep that you rather not be diagnosed.
So I will just give you an example. So you know we do race for sudden, right? So people don't understand what is how sensitive or how insensitive they can be. So say we just went to a few runners, joggers, asking them, a group of joggers asking them to come. And when I said this is rare disease and all, the first thing they said, oh, the autistic children. I'm like, no, not really. So, so you have to understand that even I would say Bollywood, Hollywood, though there are wonderful movies that have come out, but they have very typecasted autism in one way. All right. So the other way around is the teachers. Some teachers, they are also not in that psychological mindset to actually, be in that zone to actually look at the child, look at the parents, be empathetic enough to say certain things. I feel when training is there, even the background of the teacher becomes very important while, you are...
As Sir was saying a while back, breaking it gently, knowing how to break it to the parent
This
as
should
well.
be done by the school counselor. And in many schools, the school counselor is just a name. Nobody has seen a school counselor. Because they are supposed to have a school counselor, the school counselor stays. And it's otherwise just a name.
As in, they are on the books, but they aren't really there.
And we must also, get this message across that labeling someone with a criterion, with a diagnostic and statistical manual, the DSM criteria, it requires an objective assessment. Because like, you cannot label a person a diabetic without doing a blood sugar, unless and until you've administered the multiple tests to a person who is neurodiverse and you've come to a definitive conclusion. There is nobody has the right, not even me as a doctor has the right to label someone something. So when you're making a referral, like Oshiman said, or Dipanjana said, that a school counselor, class teacher, whoever is making the referral, they have to be very careful about what words they're using, because we don't want to be setting off a panic reaction here. We need to tell them that, look, your child is showing signs that he or she might be special, maybe different from the rest of the class. So let us find the difference. Let us find what is special in our child, and then we can help your child. The moment you tell them something like a disability, we don't talk about disability now, it's all in the eyes of the person who is seeing it, right? We are trying to get them to be treated as special children, because they are indeed special, because when they go through the whole treatment and they reach their potential, we realize how bright and how beautiful they are, right?
So, but here also one thing, like, when you are when you are making a referral, there is a responsibility there, that, you have to be very, you have to explain to them what is happening. Like if Sir or Oshnanda makes a referral to genetics, people would be very, I don't want to go to genetics. Why should I? So even when we are making a referral like this, see, it's not easy for the parents. Like being a mother, if somebody says something, it's not an easy thing to even accept. So you have to understand that point. So somebody has to actually counsel over there, spend some time. It cannot be in a PTM, you are sitting in a class which is like 100 people and you are just narrating at, your child is very ADHD থাকতে পারে, আপনি তো একটু assessment করে আসো. That's not the way. And that is how it is done. So that is definitely not the way. So you have to isolate, you have to speak, you have to be empathetic. You have to also tell them the consequences. What happens if there is a diagnosis? What happens after that? And how the parents can deal. Like, you have to spend that time with that person when you make a referral. Because obviously, I have doctors who are patients whose children, sir, everybody will agree, then they are probably the most difficult parents, যাদের বাচ্চাদের autism হলে, to convince them to go to and see a therapist or a doctor or anything of this.
Very true.
Because they have a lot of, they know what is going to happen, and that is why they are scared of it. Okay, so borrow if somebody
Somehow the knowledge scares them.
somebody is coming from a rural area to explain them apni ekhane jabe nei hobe oi hobe, that person is a clean slate, so ebar now whatever we say, people will do a chat GPT. So you have to counsel them first, because if you don't, then you are actually pushing them into not only darkness, but ওরা হয়তো ultimately সেই কনসাইটটা গিয়ে উঠতে পারবে না।
How important would you feel as counseling? How important and how early do you think it should come in?
Can I just rephrase that term? You cannot just counsel. You've got to do something called a motivational counseling. If you look at the premier mental health, guidelines, you cannot just do counseling, because, when you're counseling, the so-called counselor is on a pedestal and trying to be very judgmental. It's a partnership, right? So you have to, the purpose of counseling is to motivate the recipient to be an equal partner. Here it is the parent. Once the child grows older, it has to be the child who will have to be an equal partner in any developmental activity, in any stimulation activity that we won't want that child to go through. If the person is unwilling, there's no way we are going to get them onto the particular therapy or activity that we plan for them. So counseling is very important, not from a pedestal, but as an equal partner, and you have to do a motivational counseling. So if you go through the principles of motivational counseling, there are steps. You will be counseling people who would have zero motivation. Then you would have to probably take up that child or that parent in a stage where he is reluctant but has probably seen some benefits as to whatever you've told them. And you will have a third group who would be ready to jump into whatever you're telling them to do. So the methods are going to be different, and at all stages we must remember that for the best results, we have to make them partners in whatever we tell.
What do you like to add?
I would like to add the same. The counseling is very much important, as what Sir said. But the thing is, like, the counseling needs to be in a, like, the guidance. It has to be not, maybe it's not a short a session or something like that. It has to be periodic counseling, like after maybe 5 sessions, the parent has to go back to the counselor, and then again back to the same, and the counselor takes who's counseling, who has to take as a principal role, in which, like, the school is also connected, the parents are also connected, the therapist, like we also get connected, even the doctors who are treating them, and whoever, the whole team has to be connected, and then everything gets sorted out. Because even after, like, suppose I'm just like a simple example, like a 3 years child, once he starts with a therapy with autism, now the thing is, like, now the science says, like, autism gets bhalo hoye jaye. So I won't say no, maybe the level gets down, কিন্তু তারপরে কি, তারপরে হয়তো ওর একটা পার্ট আসতে পারে ADHD যেতে পারে, মেবি LD আসতে পারে, কিন্তু তারপরে LD যখন আসবে, তখন কিন্তু পেরেন্টস কি করে, কি এই অটিজম পার্টটাকে বলেই না, অনেক সময় হয়তো এই জিনিসটাকে হিস্ট্রিতে বলেই না কি ওর অটিজম ছিল কিংবা ইয়ে ছিল না, ও পড়াশোনা করতে পারছে না। সো ইটস লাইক অনলি দ্য অ্যাকাডেমিক তো খালি হবে না, তো প্রিভিয়াস হিস্ট্রি আর এইসবগুলো তো দেখতে হবে কি না হচ্ছে। সো কাউন্সিলর ওই সময় পার্টটা উইল প্লে আ লট, লাইক ইন দ্য, লাইক পার্টিকুলারলি will make a good team, as well as to guide the parent ki khali oikhane ge stop hole hobe na, maybe till class 8 আপনাকে এই জিনিসটা হয়তো থেরাপিটা লাগবে, whatever, like, to so that he can reach up the goals.
এখানে আমি বলবো, অনেকেই যখন আমরা বলি যে এখানে যান, মানে থেরাপিস্টের কাছে, ফার্স্ট কোয়েশ্চেন, মানে কতদিন হবে? তো the first thing which মানে I at least say is that, see, this is not it's not a disease.
It's not common cold.
It's not a disease. It's a condition. আজকে যদি আপনি বলেন যে ডায়াবেটিস কি আমাকে একবার দেখাতে হবে, আমি তো বলবো যে না, আমাকে তো ফলো আপে থাকতে হবে। তো আমি বললাম ফার্স্ট অ্যাসেসমেন্ট করুন, করে দেখবে, কিন্তু ইভেন আপনার টাইপ অফ থেরাপি অ্যাজ দ্য বাচ্চা গ্রোজ will actually change. And plus, for the parents also, you understand, there needs a lot of reinforcement. Example, প্রথম দিকে আমার বাচ্চা হাঁটতে মানে সে যদি আমি ডেভেলপমেন্টের দিনে দিয়ে দেখি হাঁটতে চলতে পারে না, ইফ উই হ্যাভ সামবডি হু ইজ আ ব্রিলিয়েন্ট থেরাপিস্ট, সেখানে হয়তো সে প্রচণ্ড সুন্দর করে দিল, বাচ্চা হাঁটতে চলছে, অ্যান্ড ইউ আই এম ভেরি হ্যাপি। এবার নেক্সট স্টেপ, বাচ্চা কথা বলছে না, হ্যাঁ, আবার ঠিক আছে আমি ওরোমোটার করেছি, এই করছি সেই করছি, মানে এখনই আশমানদা বলবেন স্পিচ ওরোমোটার নিয়ে হি ক্যান গিভ অ্যানাদার লেকচার, বাট দেন যাই হোক, এবার বাচ্চা কথা বলতে শুরু করেছেন, এবার বাচ্চা এজ অ্যাপ্রোপ্রিয়েট কথা বলছেন, ঠিক আছে? সো সি ফর দ্য প্যারেন্ট অলসো ইটস ওয়ান আফটার দ্য আদার, অ্যান্ড দিস প্যারেন্ট অলসো ইজ ফ্রাস্ট্রেটেড, দ্যাট প্যারেন্ট অলসো নিডস আ রিইনফোর্সমেন্ট। মানে ইউ ক্যানট গো অন. For the parent is like, I'm seeing a never-ending journey where I am always taking my child into therapy. But there has to be this one person who says, no, see, look at the road you have come and your child is doing well. And then there are parents who will say, কিছুই তো হচ্ছে না, তাই না আমি থেরাপি থেকে সরিয়ে নিয়েছি।
The emotional toll sometimes is...
So then you have to make them understand কিছু হচ্ছে না মানে you are expecting a magic, and the magic will not happen. It is small changes. It's like, me and my weight loss journey, I can say. Like, I will go to gym for two weeks and then I'll say, ki kichui to hoche na, and I'll leave it. But if somebody reinforces me over there, no, it's fine, you have lost an inch, or, you are looking deeper, and you feel, acha, something is happening, so you go. So I think that reinforcement to, ekhon ekta bacha je special child, baba ma হয়তো একটা সোশ্যাল ইয়েতেও যাচ্ছে, দে বিকাম ভেরি এম্বারেসড একটা কোথাও গিয়ে, এবার ওদের মধ্যেও কিন্তু সেই রিগ্রেশনটা হচ্ছে, কি হলো, কিছুই তো হচ্ছে না, এত থেরাপি করছি, এত পয়সা খরচা করছি, কিছুই হচ্ছে। You also have to understand their frustration into the entire thing. So counseling at many points, beginning sir said motivational, Oshmanda bollo je, it has to work as a cohort and a group, and then the reinforcements have to come. Because it is not one single day, one single month or 6 months. There are many people who will come and say, অসীমাদার কাছে আছে, মানে আমার অসীমাদার পেশেন্টস আছে, they'll come and say, না প্রথম দিকে না খুব ভালো হচ্ছিল, এখন না কিছুই হচ্ছে না। সো সেখানে যদি ইউ সে যে ও মা হচ্ছে না, তাহলে তো খুব বাজে থেরাপি হচ্ছে, বাট ইউ হ্যাভ টু মেক দ্যাম সেট অ্যান্ড মেক দ্যাম আন্ডারস্ট্যান্ড যে মানে সত্যিই কি হচ্ছে না। হ্যাঁ, মানে so that realization has to be inculcated or reinforced.
So what would you think are the emotional toll that you see in families who are navigating the disease, the stigma maybe?
So it's huge, actually. A lot of it has been elaborated by Dipanjana. Two very important points. One is tackling fatigue, right? Because when we talk metaphorically, like she was speaking a while back, we have to give very relatable metaphors, right? So what I tell a lot of these patients is, আপনার তো চোখে চশমা আছে, রাইট? এবার আপনি যদি চোখের যখন চিকিৎসাটা করছেন, অল্প পাওয়ার দিয়ে শুরু হলো, আপনি পরিষ্কার দেখছেন, আপনি খুব খুশি, কিছুদিন পরে একটু আবছা হলো, আপনার পাওয়ারটা বাড়লো, তখন কি আপনি বলবেন আমি চশমাই পরবো না, রাইট? সো there are very similar human conditions where this very vulnerable human body and mind can have challenges যেটার জন্য আমার সাপোর্ট লাগবে। এবার এই যে অনগোয়িং যে জার্নিটা, this is one of the aspects of our life's journey where I need support. Just like I need a spectacle, or if I am a diabetic, along with having a spectacle, I need that as an additional support. This will also need a continued support. And this support is something which the person deserves so that they can achieve their potential. I cannot at any point in time, আমি বলতে পারি না যে এই অবধি করবো তারপরে ছেড়ে দেবো। জাস্ট লাইক আমার যখন চোখে ছানি পড়বে, আমার পাওয়ারটা আরও একটু না বাড়িয়ে আমাকে কিন্তু ছানির অপারেশনটাও করাতে হবে। সো we need to get that across in very relatable metaphors that this is a journey. You are not alone in this journey. I am there with you. There are other people. Dipanjana is there. Oshiman is there. There are other people with you in this journey. And wherever you come to a bend, you come to an obstacle, We are there to cross the bridge along with you. Having said that, none of us live in utopia, neither physically or mentally. We have to give them their space. If there is going to be an interruption of therapy, and I think this is something we all encounter, any long-standing conditions. Do diabetics not skip medications? Do I not feel fatigued by the fact that I'm wearing a spectacle? Take it off. Start exploring options so that I don't have to wear a spectacle. So humans will have this fatigue. We have to be, as she very correctly said, reinforcers during these fatigues. We mustn't underestimate the toll it is taking on the caregivers too. What's happening to that mother or that father or that family about just taking a holiday? What's happening to them aspiring to have, say, a swanky mansion? It might be well within their means. But if they have that as one of their life goals, we have to help them lead their own lives too, rather than get consumed by the fact that they're taking care of a neurodiverse child, right? So the toll is huge, but the only way we can ameliorate a little bit of their difficulties is by being co-passengers in this journey. We can, I won't say it's a never-ending process, right? But it is a process which helps us achieve the best potential we can. If our parents didn't hold our hand, would we be here, wherever we are? So that is why these children with their special abilities need a hand holding as much as you and me do.
And another thing is, sometimes we get thrown off by social taboos. আমি একটা বিয়ে বাড়ি গেছি, আমি একটা birthday party গেছি, এখানে it might not be somebody else saying anything, but might be my own reflection, that আমি গেছি, ওদের বাচ্চা তো এরকম, আমার বাচ্চা এরকম কেন, আমি এটা কোথাও যেতে পারছি না. I cannot take my child to a shopping mall. Simple. I cannot go to a movie theater. I cannot go, and my child loves this individually, but I am also getting isolated as a person, and I am not a person who wants to be isolated. I am a person who wants to be social. So, এগুলো কিন্তু we also have to understand where the parents are. এখানে আরেকটা জিনিস যেটা হয়ে যায়, যেটা I guess we both understand that these children who have these kind of diagnoses are very dependent on one of the parent. And when it's never both the parents. Either the mother or the father. But for the mother or the father, maybe love, I always say this to all people in this journey, that you might love your child, but still you might find annoying. And that's an emotion that's okay to have. But ওদের জন্য কে validate it? As a couple, when I understand, in India, we don't talk this too much, but even with absolutely normal children. But as a couple, this couple also has some couple aspirations. With a child clinging on to one parent, this parent is not free to do any other things with the other partner. And that partner might get estranged because of that. So, we are thinking this is one diagnosis we are giving, but that family might be having a lot of other issues that is going on. And that family might not be very openly discussing it with the therapist. They might feel, ashamed of it, or guilty, or, not being there. So, এই জিনিসগুলো কিন্তু বুঝতে হবে. There is a lot of that, but there is a lot of economics to it. When I started off the therapy, I was in a very good job. When I am continuing the therapy, I am not doing well because of many reasons, because even of what is happening at house, I'm not performing. And I am going down the ladder in my professional field. If I am doing that, I am not getting the money also. I cannot afford this also. So it's when we say that sometimes we skip or we stop. Skip a stopping into, it's just not one day we are just frustrated. There is a lot of other stories to it. So, এরকম সময় I think if there is a community of people with who, other individuals who are there, these people might feel a little less alone. So, because sometimes, you reach out to these people and there are many people with the same kind of, situations. And when they talk, like see, if three friends are talking and they are talking about their whatever is happening on their lives, you feel better after that. Nothing is changed,
Nothing has changed.
but you feel better. So I think that space also needs to be created.
So would you like to add something to that?
Nothing more. I should just support groups, having buddies, together, so that they can share experiences, right? And I think so. We have support groups for every condition, every conceivable condition, right? And as a doctor, as a therapist, what I'm telling my patient, sometimes we need to share things if we are in the same boat. So that is where these buddy relationships, where these support groups, they come into play. And it's imperative that we direct them towards these support groups, because sometimes I may not be able to tell the person which is the best school in their vicinity, or which service is more accessible to that person in Newtown staying in Goria, right? So this is where we need to foster these, relationships amongst the neurodiverse population, as well as amongst the caregivers. So the support groups and buddy relationships are very important.
Oshmanda bollo na je, you have the therapist, the doctor, the psychologist, everyone in the group. This is also a very important space to have. Reinforcement comes a lot from the support.
You get a sense of belonging where you are feeling left out and stigmatized. You suddenly feel there are others.
You have a social life which you were not being able to have
Amongst people who understand. That's an amazing support system to have.
Yeah, I mean, and people have to understand, like, I'm so happy, that some centers have now come up in Kolkata where a person can report to a place and get all the modalities of therapy. Somebody might need an occupational therapy. Someone might need a play therapy. Someone might need some sensory stimulation. Now, I keep telling parents that supposing your child had to go for a math class to some part of the city, English class to some other part of the city, how would it be for you? So that is where we need to make sure that under a roof, we are able to give most of these children what they need. Because parents, if they have to crisscross the city and go from one place to another, where is the time? How will they lead normal lives? And where is the time for the child to get settled into an environment if they're going to be changing places for every little therapy that they need, right? So it's something we need to be pondering upon, and having these centers where everything comes under a roof is very important in making sure that they continue therapy.
Can you just let me add this? This is a city we are talking about. Just understand what happens in the rural areas and towns. There are people, babies, though it's not like everyone is in the city. There are people who are living in towns. Say, for example, yesterday we had a child who was coming from a place which was Kulti. Like it's in Asansol থেকে অনেক দূরে. And Asansol আসতেও it is like 40 kilometers. ঠিক আছে? তো তাহলে how will this person do a therapy on a regular basis? যদি আমাকে and everybody does not have a car or public conveyance নিয়ে আসাটাও every day is difficult. So we have to understand it's not easy for the parents and that empathy has to stay.
Speaking about the suburban areas, as you were saying, what kind of awareness do you think is required? What kind of awareness programs do you think is required?
I don't think there's a dearth of awareness programs, frankly. I feel we are overdoing it at this moment. But where are the skilled people? And I can have 10 centers. There's no problem. There can be somebody who can sponsor 10 centers. But it will not could have.
There's nobody to answer your queries once you know.
Skilled people over there. We are getting are people who are pseudo specialists and they are doing more harm.
Yeah, I mean, resource crunches are going to be there. The skilled personnel, as Dipanjana mentioned, there is a scarcity as of now. But again, those logistics are dictated by our population. At the beginning of our talk, we discussed that. So today, as a government, as an individual, as any organized body, I can probably be making a provision for, say, 1,000 people, right? In 5 years' time, that's going to be 5,000, right? So these resource crunches are going to be there. So which is why it is so imperative that we develop models of therapy where the parents become equal partners, right? Unless and until they are made an equal partner in the therapy, they won't be able to sustain themselves. Okay, I know of fantastic parents who have trained themselves so that they not only treat their children, but also another few in the vicinity, right? I know of many such examples, right? But this percolation of empowering the parents and the caregivers with the special skills, right? And knowledge, the more it spreads, the awareness spreads, and more important, it's not just important to be aware. I need to know the solutions. So where do the solutions come from? It's only when I empower the parents, A, to detect, B, to get it diagnosed, C, to get onto the therapy, and most important, to sustain the therapy at home and in situations where everything may not be available. So that is the only model. I mean, unless and until at the grassroots there's an empowerment, it is going to be very difficult, because how many people are you going to be training for a country of 1.5 billion? It's difficult, right? And we cannot expect somebody else to do the job for us. Unless and until I take complete control and say, this is my child, fine, I'm going to Dr. Dipanjana, I'm going to Dr. Shiman, they're doing their level best, but they have 100 other kids to see. So for my child, if I can empower myself, that would be the best service that I can do.
And with the rare disease patients, like physiotherapy and all that, there are many patients who actually do the course. They actually get it because 3 বার করে 4 বার করে যখন পড়াতে হচ্ছে, it is impossible for them financially to support. So they follow up with a
A specialist.
list, but at the same time they learn, because at least যেটা শিখে আসছে থেরাপিস্টের কাছে সেটা যেন করতে পারে. Many of them actually have done a physical course to actually do it right, and because that saves a lot of us. সবসময় হয়তো সেগুলো possible not, but in many cases these do render a lot of good outcomes.
What role do you think technology plays in supporting neurodiverse learning? Are there any risks involved?
Risks are there, like addiction is there, number one. But if the parent, what sir said, if the parent take care of that, simple, if they ask what they are watching, and then they can narrate a story from there, then আমার মনে হয় তাহলে ওই জিনিসটা আর কোনো প্রবলেম হবে। কিন্তু ওই যে বসেই দিলাম, দিতে হবে, মা কাজ করতে চলে গেল, ওই পার্টটা যদি কাট আউট করে যায়, তাহলে কিন্তু অ্যাসিস্টিভ টেকনোলজির পার্টটা একটুখানি হয়তো দিস উইল অ্যাড অন টু সামথিং। কেন কি যেটা মেইন যেটা দেখা যায় কি, পেরেন্ট করে দিল, মোবাইল দিয়ে দিল অ্যাট দ্য ভেরি ইয়াং এজ, অ্যান্ড মা হয়তো অন্য কাজ করে নিল, ওইটা ইজ আ লিটল বিট হার্মিং। কিন্তু কিন্তু ওই দিকে যদি অ্যাকাডেমিক্স যদি দেখা হয়, তাহলে ওকে যদি অ্যাসিস্টিভ টেকনোলজি আর যদি রাইটিং যাদের হয়, যে স্পেলিং মিস্টেক করে, সে আর স্পেলিং মিস্টেক করবে না। সো এই দিকটা, এদিকে গুণ আছে, এদিকে সামথিং দ্যাটস as a pros and cons.
It's a mixed blessing, right? Like for any technology, I remember when the television came, it was labeled as an idiot box, right? Okay, but we all, saw television. There's not a soul on this earth who hasn't seen a television. There's not a soul on this earth who's not using technology. What is important is we use the beneficial parts of it, or speech to text, or a text to speech, or certain apps, okay? But privacy, confidentiality, addiction, these three things, there are preventive measures. We have to be aware of those preventive measures, because these children, as we've been discussing, they tend to get into a cocoon. They have very little social interaction. So if they find something which is, making them feel happy, they get into that cycle. There's a dopamine surge. They want more and more of that. So we've got to prevent that. How? Like what Oshiman said, they might learn a story or they might go through a chapter, but let's do a repetition of that by a human interaction. We cannot just leave it to technology. Let them grasp the chapter, but then let's do a rehearsal face to face. So a balance has to be there. Technology is here to stay. It is here to help us, provided we take the cutting edge from it. If we are going to allow it and to infringe onto our other private spaces, and if we are going to allow it by making our children vulnerable to what's in the cyber world, then we have a problem. But with anything, I might be driving a car. If I don't know how to use my brake, I shouldn't be driving a car. Anything that you do, if you aren't aware of the safeguards, you shouldn't be using it.
Coming to workplaces, how do you think workplaces can create environments for neurodiverse individuals?
Coming up, actually, you're talking about more of sensory part. So the environment for them needs to be a little bit like quieter environment, and it's a cozy in the sense, like suppose maybe maybe I don't like to sit on the sofa. Maybe I'm whatever your questions and whatever you're asking, maybe I stand there. So what will be what are the changes you are making in the whole setup? So maybe the camera needs to be again focused to my side, maybe the other side of the camera, the other side of this room, or maybe suppose like if I sit here, so probably again the camera needs to be focused up a little bit. So these are the changes. So you cannot just maybe you cannot just put like a points, like put in a box like these are the changes for a child with ASD or whatever the level, the SPD, because of the sensory processing disorder, whatever is that. So that needs to cater like customized or whatever is that. So it changes according to which the child is having a little bit more. Maybe the arousal side needs to be a little bit down. So these are the things. As a simple,
basically, we need flexibility, both in terms of working hours, flexibility in terms of environment. If there are, especially when you're talking about a workplace environment, so if there's something that the person can do from home, should be allowed. If there are hours that can be adjusted flexibility wise, that is the key word. That workplace has to be flexible. They will need more explicit instructions. Supposing there's a boardroom meeting or something, whatever instructions are given to the rest of the team members, if I'm sensitive, if I'm empathetic, person X might need an additional set of instructions, both visual as well as verbal. So those have to be taken care of. So that flexibility has to be there in the employer-employee relationship, as well as making it comfortable, whether it's the environment at home or the environment at the workplace. And like he mentioned, everyone, and these people have an issue with their social communication. They love their own spaces. We've got to create spaces for them.
So, and I just add, it's just not workplace, it is also education institutions. So I'll give you an example. So, specific. So, there's a very beautiful, nice girl at Delhi, and she's studying psychology. She's not really neurodiverse, but she has a diagnosis of a collagen disorder. So she's hypermobile, right? She got a disability certificate. She's brilliant as far as her studies are there. She's the top 1% of due to that. Very recently, I did show you the messages. She's continuously messaging me that what she has asked for is that she, because of her issues with her joints and all, it has been very difficult for her to do the practicals, because this was the practical semester and was very, she's finding it difficult, and she's finding it difficult to balance because they have to go up and then go down and then go to the class. And, there's too much of her traveling, in the sense inside that. And she just requested whether the classroom can be brought up at the same place where the lab is. And there's a possibility of doing that. And she also requested that if for her, just for her, her submissions are at least 10 days later. That she needs an extra time because she has hyper flexibility, so her writing becomes difficult for her for long periods. So she had first approached her professor, who said, okay, I will see to it, because she has a disability card, etc., and put it to the head of the department. The head of the department put it to the director. The director said, for doing this, I too will need, the board. They put it to the board. The board said, can we do এরকম কিছু করা যায়? So the board put it to the UGC. এরকম একটা স্টুডেন্টের জন্য can we do this? But tell me, is it so difficult? At the end of this entire thing, if the professor or the HOD was empathetic enough, tell me, do you actually need
this much of? And it doesn't need rules.
There is no rule, right?
It doesn't need rules.
So একটা অন্য example দিচ্ছি. We had a DMD child. A DMD is Duchenne muscular dystrophy. It's a condition where the child initially can walk, but then starts to fall and they cannot climb stairs, but they are intellectually fine. A few of them do have some hyperactivity and ADHD, but most of the time these children do all right. So we had them, I'll name the school also over here, South Pointed, please. And what happened is, when this child lost ambulation, they did not have a ramp. Okay? And they did not have a wheelchair toilet. Okay? The parents complained. No, listen to this. The parents complained, and the school said, we will look into it. This parents complained around May, যখন স্কুলটা বন্ধ হয়. The children's come back, there's a ramp, there's a wheelchair, bathroom with a no commode in every floor. So that's action. It's not so difficult.
Just a little bit of consideration to make it easier.
So then what they did, they asked the parents to go and give a talk on accessibility. And they said, I don't know how for so many long years, South Point is such a old school, we didn't have accessibility. It's shame on us. You shouldn't have told the students. This should have been there in the school. So you understand, that is what inclusion is. And it's not so difficult.
It's refreshing to see that, and as you said, not so difficult. Moving on to our next question. What changes in educational policy would you think are required to integrate more of these individuals into the society?
Right. I think so. We've been discussing this, that it cannot be an either-or situation, right? There has to be inclusiveness. That is, we have to get them to have access to mainstream schools. But in order to implement that ideal, we have to have the infrastructure. We have to have accessibility for anyone who has any special needs. We have to have teachers who would be well trained to take care of the special needs. And we also need to have specific instructions, specific addressing of the needs of the special children. So when you formulate policies, educational policies, funding. And there has to be a separate funding for these children. Because, I can't do something, even if I have to create a separate space for a child who's having a breakdown in a class full of children who are screaming otherwise. Or if I have to, give that person that extra time to complete an examination paper. You need the funding for that so that this person can be supported constantly, consistently. And when we are talking about policies, we have to make these policies implementable. India is a country which has got multiple rules, probably the best set of rules. We have the best constitution in the world, but how much of it gets implemented at the grassroots level? So policies are fine, but they need to be audited. People have to be made accountable, and unless and until they are implemented, these policies would not see the light of the day.
And I'll just add to that. Number one, for policies, when it supporting the government, you need concrete data registries. Policies will not come out of thin air. Where are the registries? Okay, how many children do we have? How many children will the government have to cater or the schools have to cater? So if you don't have that, what happens is you don't know how many school counselors you have to place, how many shadow teachers you have to place. You don't know how many sensory rooms you will need.
Correct.
You don't know whether... So it is a shame we still don't have a vocational training center for these children, but there is none. It's private, there's nothing in the government. Private, it's very bleak and they charge a lot of. Okay? So policies don't come out of thin air. For policies, people have to publish. Like people have to record the data. There has to be a registry. There is government. There are women and child healthcare. There are segments which are supposed to look after that. So you're saying they are all under books. But if you look at the data is not there. If there is no data, then the government, government is bureaucracy. Bureaucracy তখনই কিছু করবে যখন I see some ফাঁকায় তো করবে না অসীমানদার কাছে এসে যে হ্যাঁ গো তোমার আজকে 100টা পেশেন্ট আছে, আচ্ছা আপনার 50টা পেশেন্ট আছে, আপনার 20টা পেশেন্ট আছে, আচ্ছা let's do it. It's not like that, correct? So what you need is basically a registry যেখানে people will record. এবার এরকম রেজিস্ট্রি কিন্তু অলরেডি বিকজ ডিসেবিলিটি কার্ড হয়, এরকম রেজিস্ট্রি কিন্তু অলরেডি আছে। এবার যখন আমরা এইসব এত কথা বলছি, হ্যাভ উই এভার স্পোক অ্যাবাউট ব্লাইন্ড অ্যান্ড ডেফস? ইউ আর নট, রাইট? তুমি কোনো স্কুলে দেখেছো ব্লাইন্ড আর ব্রেলে কিছু শেখানো হচ্ছে, বা কোনো সিগনেচার দেখেছো আমাদের এত বিশাল জায়গায় যেখানে ব্রেলে কিছু হচ্ছে, ডেফনেসের জন্য কিছু হচ্ছে? দ্যাট ইজ ডান। সো ইটস ভেরি ইজি টু স্পিক. But it's very difficult to have a policy and then have that policy and then have it implemented. কিন্তু ডেটা কি নেই? ডেটা আছে। কতগুলো ককলিয়ার ইমপ্লান্ট হচ্ছে গভর্নমেন্ট নোজ, কতগুলো আই ট্রান্সপ্লান্ট হচ্ছে বা হোয়াট এভার আই এর যা হচ্ছে, সো মেনি সেন্টার্স, এভরিওয়ান নোজ এভরিথিং। আরওপি হচ্ছে, সবাই জানে কি হচ্ছে। বাট there is no comprehensive database from where these policies can be implemented. এবার পলিসি করলেও এবার তাহলে এটা কেন লাগবে? কারণ তাহলে টু আন্ডারস্ট্যান্ড দ্যাট ফান্ডিং কোথা থেকে আসবেন। এবার ফান্ডিংও যদি আসে তাহলেও কি এটা সব জায়গায় ইমপ্লিমেন্টেড যদি হতে হয়, তাহলে উই নিড স্কিলড পিপল, তাহলে সেই ট্রেনিং লাগবে। এবার শ্যাডো টিচার রাইট নাও ইজ লাইক a very difficult concept because not everyone is trained to be a shadow teacher. ঠিক আছে? এবার এইগুলো সব যদি হয়েও যায়, লাইক সে আচ্ছা ঠিক আছে ম্যাজিক্যালি এভরিথিং গেটস সেটেল, ঠিক আছে, where is the awareness for other so-called normal parents to actually see these children study with these children? And that is not once. ঠিক আছে? So understand as a society, we are very immature. It's heartbreaking to know the stories of the parents, and as a society we are very immature. It is just example all of us sitting over here, if I see a child with dysmorphic facial features, ekটু অন্যরকম দেখতে পাবেন, ঠিক আছে, won't you ogle at the child with all our training, with everything around? Won't you ogle at the child? I will. I have no shame in saying that I will give a second blow. I'll give for different reasons, but I will. But I seen me when I was practicing outside. we used to see these children, like these children used to study in my daughter's class also. They were also, it's like they are there. Everybody was like, okay, they are there. There was no, that turning back, oh, cha, old bacha na special child.
There's no judgment or
It's not like that. Even now, if we have to speak, like, if there are colleagues who have children, we would say, Are jano na, old bacha na special child. Why? It's a judgment you are passing. So these normal people also have to be normalized to, be with these people. You were talking about workplace many policies. Workplace policy, they can't speak up for themselves. So if they are doing a project, if there is a super smart type of a person, আমাদের নর্মাল লোকেরাই হয়তো অনেক সময় বলতে পারে না ওরা প্রজেক্ট চুরি করে নিয়ে চলে যাচ্ছে এই নিয়ে চলে যাচ্ছে. I'll give you another example. There was a child with Down syndrome who was working as a front office support in one of the very premium hotels. Okay? They had connections, so the child got through and she was there and they wanted to keep her. And it's also a fashion right now to keep, people with special needs, showing that you are so empathetic. This child was bullied so much that she actually came back saying, I don't want to work. I just want to be home. Not because she was very excited when she got the job. But 3-4 months down the line, she's saying that, I am not being treated the way I am, with the dignity I was supposed to be treated. So, just having policies will really not matter. Like, আমাদের workplace, এখন posh wash আছে for women safety. You also need something for these people.
as a person who has been practicing in this field for quite a while, what would your message be?
My message would be probably for the so-called normal people to understand that none of us are actually normal. We all have some problems in us, and to reflect back and be more empathetic before judging others. I know judging comes very naturally to us and we love doing it. But to a certain extent, judge less for these parents, be more supportive. And for the parents who have children who are neurodivergent, I would say don't beat yourself up. Everything takes time. We have the banyan tree and we also have the shrub, which is a rose. Both will not grow equally, but both are beautiful in their space. And I think we should also remember as caregivers, as maybe sitting on the other side as healthcare providers, as schools, as, other professionals, that I think in the animal world, we see there is space for everyone. Everyone is not supposed to be a go-getter. And we should start appreciating the slow people, so-called slow people as well. They might have a different life destiny. And everyone does not need to be a CEO in a company or a doctor or an engineer. Somebody can just be themselves. And that's also enough. So for all the people, don't beat up for yourself. And other people should be empathetic, read up more, be more inclusive in the mind. Sometimes we are very inclusive in our words, but not in our minds. So that is something which I would say that next time when you come across some things, some individuals or some parents, or you yourself are that parent, then be inclusive in your mind, not just in your words.
So for me, Meekla, I think the most important message is difference is not a disability, right? And we've all been discussing a lot about what is actually implementable on the ground. It's a process, okay? We are recognizing a lot more. If I may say so, we are recognizing a lot more earlier. So we are getting better results. So let's keep it going. And let's remember that difference is not equivalent to disability. Let's not be disheartened by the differences. Let's embrace the differences and allow them to achieve their potential.
That's all.
And from that, I just want to end it like the awareness, like moving from awareness to acceptance and the inclusion. So awareness says like, I know this exists. Acceptance Acceptance says, I respect and support it. Inclusion says, you belong here. So this requires changing attitude, not just adding policies.
That is an amazing end to a very, very informative discussion. Thank you all for being here today.
So at the end of the day, you're done with your work, you attended to your patients, and you come back home. What is that one question that comes to your mind?
The one thing that I feel at the end of the day is seeing my patients is, number one, being very grateful and also very inspired with the journey of these patients and their families. When we give a diagnosis, we actually don't give a diagnosis to that particular child. We give it to that family. And their journeys have been extremely inspiring for all of us. So the question I really have is how? From where does the strength come?
Hope you enjoyed our episode today. Do leave us a comment. Like, share and subscribe our channel at Truth Forecast.